Well, joining me now to talk about this is Nia Fisher. She had early menopause when she was 35, and also Dr Monah Mansoori. And Nia, you weren't treated particularly sensitively, were you?
No, not at all,
to
unfortunately.
Put it lightly.
Yeah. I could have been talking to the consultant. Once I was diagnosed, the consultant who was responsible for talking me through options of treatment, for example, HRT, I could have been talking to him about a cold. The fact that his office was in the maternity unit of the hospital and I was waiting in the waiting room with mothers and babies only 2 weeks after finding out I was infertile was just the craziest, most surreal situation to be in.
It beggars belief.
It really does.
So what do you think then today about this revised advice, if you like, for dealing with women going through the menopause?
I think it's a very good thing, especially that it mentions women under 40, like myself, because it's a sensitive time for any woman, no matter what age, but when you go through it early, it's especially sensitive because you don't necessarily know anybody else. None of your peers or friends are going through it at the same time. So you feel incredibly isolated, incredibly alone. And that's when you really need to be treated with just a little bit more sensitivity and to be given as much information as possible. I was completely in the dark about it.
Monah, as Nia says there, it can be difficult for any woman at any time because every woman goes through it. And most of them experience symptoms. So why is it taking so long for the medical profession to catch up with it?
I think it's a number of reasons. I think part of it is that, we've not had the same confidence in things like HRT. I think there's obviously so many different types of HRT available. Probably training in giving and advising about HRT could have been better. I think we haven't necessarily considered things like the psychological impact of going into menopause and how that impacts, your daily life, apart from the hot flushes and the change in skin and all these sorts of things. I think the mood issues and the potential anxiety related to menopause are particularly significant as well.
Just briefly explain what HRT is, because it might not be clear to everybody. It might be clear to some women who perhaps know they're going to go through the menopause soon, but everyone else might not really get it.
Well, that's right. I think the key thing about hormone replacement therapy, which is what it is that there are many different types. So you can get things which are just estrogen alone, patches, for example, or topical treatments. There are combined HRT, which is estrogen plus progesterone. Sometimes you need to involve using things like coils that deliver progesterone to protect the womb in women who still have a womb, for example. And sometimes you also include things like testosterone as part of an HRT program. But these all need to be tailored to the symptoms of every individual patient on an individual basis based on what they're experiencing.
And yeah, that's the point of all of this, isn't it? It's not one size fits all. Every woman's different. Every woman experiences it in a different way. Are you optimistic that they will get treated specifically to their needs?
I really hope so. I think you have to be optimistic. I think discussions like this are vital for raising awareness and to get the message out there that every woman is different and information is key.